I am Dr. Thompson Tuba. I'm the editor of Health and Development magazine. Who am I speaking with?
My name is Colonel Deidre Tanyan.
What's your role in the military?
I am the Director of Health and Wellness for the Office of the Surgeon General in the United States Army.
And that is General Patricia Hororo, right?
That's correct.
Last year, during this annual meeting, the audience was told that the military is moving from a system of healthcare to a health system. What does that entail, and what has been done so far?
So if you think about it, the average soldier and their family seeks health care only 5 times out of a year. That means 100 minutes of the year they're actually a patient seeking health care. The other 525,500 minutes of the year, they actually are people. And so the Surgeon General's vision is that we actually reach out and touch people where they live, love, and labor. And so we actually have to get outside of the brick and mortar and figure out how to make the communities, the resources, and things available so that the families have access to become healthier and not just go to the healthcare system when they're sick. And so we want to focus on delivering health and not just healthcare.
It is said that 70% of would-be soldiers get to be disqualified because of obesity or overweight. How serious is that problem, and what's the Army doing in order to inform and educate the general public on that?
Yeah, so if you look back at World War II, when we had to get 1 million people into the military, we had to screen 2 million to make 1 million that actually met military standards. If we had to do that today, we'd have to screen 4 million people to have 1 million meet military standards. So clearly there's a problem. And so we need to be reaching out to our communities. And so the Surgeon General's vision is to change the health of the nation by changing the health of the Army for that particular reason.
And finally, it is said that there are 3 very important components of the present emphasis on health that the military is looking at: sleep, nutrition, and exercise. How has that been put into practice in your own life? Because you look very fit.
Oh, well, thank you so much. Yes, the Performance Triad is about sleep, activity, and nutrition, and it's all about the small changes that make a big difference. So it's about making sure you're getting 7 to 8 hours of sleep at night, you're going caffeine-free 6 hours prior to bed, you're eating 8 servings of fruits and vegetables a day, you refuel after exercise within 30 to 60 minutes, you get 10,000 steps spread out throughout the day, 150 minutes of moderate exercise each week, and 2 days a week you're doing strength training.
Thank you very much. What is the most important point in your discussion today?
So the most important point is that the reserve component and guard population in general is often overlooked, not because folks want to overlook it, but because they don't understand some of the complexities and challenges that are unique and particular to the guard population. Like, they don't live on base, they're often geo-dispersed in remote communities, and they have therefore less access to various health services and information for that.
So do you think that, is there any study that shows any form of disparity between the guards and the reserve and those who are on base?
Yes, there is a RAND study, and I can't remember the exact name for it, but it has to do with the fact that the reserve component populations are geo-dispersed and they have more difficult access to Army services, including health services. And it was authored by RAND last year in 2014. Again, I can't remember the exact.
They are MDs and